Welcome to Health Wealth University. This is Dr. Romy Paredes, the co-founder. And with me today is my lovely wife. She's also a medical doctor, Dr. Milagros Paredes. She's actually a radiologist and sonologist, a very busy woman. And I am privileged today to be with her in this conversation. And my first question to you is how do you see the changes that are happening right now in the general health of the population from the lens of a radiologist, sonologist?
So how do I see? Okay, that's a good question. Okay, so every day, my line of work is like I do get a lot of patients. I do ultrasound, and I get from infants to the like 80s, and some are hundreds already. And I'm seeing a trend like the chronic diseases, like the ones that are related to food, are getting younger, and also chronic diseases like cancer. The patients are getting young. Like for example, we have like teenagers. We get a lot of teenagers who come in the hospital who visits us for epigastric pain, and it turns out they already have fatty liver and GB polyps. Some
GB means gallbladder.
gallbladder
Yeah.
polyps, and some even have already gallstone at a young age. And we're also getting like breast masses early, like even cancer, breast cancer in their early 30s.
So what you're saying is these chronic diseases are becoming more epidemic and rampant in the younger population, as you are seeing more younger cases of cancer, uh, and with gallstones, with fatty liver. So, coming from the perspective of a hospital-based physician, what do you think is causing it?
Well, when I do the ultrasound, I usually ask our patients or this our clients, our patients, these young patients. So, what are their habits, or what do they do? What are their usual? What do they eat? What's their favorite food? And they usually tell me, "Oh, it's the go-to food." So, what's the go-to food? It's fried chicken. So it's the usual fried chicken, McDo, Jollibee. So the that's the usual. That's their favorite. Usually it's the fried food, and the easier they can have it, that's it.
Yeah. So,
And also the bubble tea, the iced tea,
yeah, the milk tea.
the milk tea.
Yeah.
Yes.
Yep. So these are all unhealthy patterns that lead to the disease, and even in my own work as a holistic integrative medical doctor, I am seeing the same thing. I'm seeing younger cases of breast cancer. I even have a colon cancer patient in his 20s, something that we haven't seen before, something that we are not seeing before. So, going back to your line of work as a radiologist, sonologist, you read a lot of things. And with your work as a hospital based physician, uh, how important is it to have proper nutrition, not just for your patients, but also for the healthcare providers like us, physicians, or allied health professionals working in the clinics or in the hospitals?
Well, proper nutrition, you should maybe define what proper nutrition is first. It may mean different to a lot of people,
Right,
right?
right. So, with my background in holistic integrative medicine, for me, and this is evidence based and science based, that a lot of chronic diseases is caused by animal based, ultra processed, highly processed, high fat foods. So, yeah.
I think basically education is important. It must start with education, like what's nutrition, the real nutrition, what's the right food to eat. Because, like, for example, a hot dog and a rice, the mom would think that that's okay. So every morning, it's like tosilog, hot silog, spam silog. That's the one they will give to their kids because it's easier to do, it's easier to make, it's fast, right? So it must start with education. I think it must start with the parents. So, yeah.
So health education is very
Yes.
important, and we are both doctors. And if I ask you now, maybe we could share also to our audience, was health education, or did health education play a big part of our medical educational system?
Both of us know that we have few or little units of nutrition when we had our medical education. We just learn it along the way.
Right, right. So there's that lacking, somewhat is lacking. Uh, the health education side, the nutrition aspect of health and healing, which is very important. Another thing I would like to explore to you is the life of doctors. We have become busy professionals, and that's why it is very attractive that in the medical profession we are more attracted actually with something that is quick fix, because there's a lot of people lining up, a lot of patients lining up, a lot of patients also lining up to you, not to consult you, but to have their bodies checked through X-ray, ultrasound, CT scan, MRI, and life has become fast-paced for everyone, for the patient side, for the doctor side. Like even in your case, you may admit this, but your life is very busy.
Yes.
It's like sunrise to sundown.
Yes.
And that is the healthcare system that we grow up with because of the volume of people. And in spite of the advances in medicine, in science, in healthcare, it is undeniable that there are more diseases today than ever before. So, anything you want to share on that aspect? Difficult to answer?
Yeah, it's difficult to answer because I'm also struggling
With your time?
with my
Yeah.
with work-life balance. Yes.
Yeah. So
Yes.
because I think I'm asking you this question because it's basically the system itself
Yes.
that's making it like this. It's like I heard our doctor friend, you know him, Dr. Pau Thompson.
Ah,
He
yes,
attended
yes,
our
yes,
retreat, and he was
yes.
talking about the conveyor belt of life. That even in the medical system, it's just becoming a conveyor belt. You know,
So
so
true,
people just
so
line up
true.
like a conveyor belt. Go to the lab, go to the doctor, take a prescription, take a drug, go home, and repeat the cycle.
Yeah.
Yeah. So, how do you think, if I will ask you the question now, how do you think we can get out of that conveyor belt?
How it must start with education. It must start with changing your perspective. It must start from the patient itself. If they are ready and they are willing to dive into it, because actually our patients, most of us, know what to do, but sometimes they just can't get out of it. They don't know how to. So there must be a education, and then there must be willingness to do it.
Right. That's why we are envisioning through the platform Health Wealth University a shift in what we were just talking about through education, through empowerment. So instead of creating more medicines, more products, more laboratory tests, more tumor markers, we're creating more con- educational contents that can empower people to take control of their health and of their whole life. As we speak about health and true wealth, that's why the Health Wealth University is offering educational tools like audiobooks, ebooks, physical books, programs, and online and live programs, retreats, seminars, name it. And it is a growing advocacy on bringing out the best in people. It is a growing advocacy on shifting from empires of dependency to communities of empowerment. So, in some of the retreats that we do, you handle a topic that is close to your heart, the healing power of happiness.
Yeah.
And you have delivered that to several audiences in different parts of the country, not just in our own workplace, but also in other places outside our home ground, Cebu City. So how does happiness relate to healing?
Okay. When we speak of happiness, happiness really depends. It has a lot of meaning to different people. It may mean different thing to you, different meaning to me. But the point is, we want happiness because we're thinking of the cells. Yeah, when the cells are open, and when we're happy,
Healing just happens.
Yeah.
Yeah, right, right. It's the contraction and the expansion of a cell. A happy cell is like this. An unhappy cell is like this.
It's
But
contracted. Yeah.
you cannot see that in your CT scan.
No.
You cannot see that in your ultrasound. You
No,
cannot see that in your X-ray.
definitely. Yeah.
And yet, most of us doctors, we depend on those machines. So, happiness, joyfulness, these are all vital ingredients for authentic healing to happen in us. So, another thing I would like to ask you is from your line of work, hospital based physician, very busy, handling a lot of patients on a day to day basis. If sometimes you feel like you're in that conveyor belt, uh, are you interested? Are you willing to imagine how to redefine or restructure that conveyor belt? Because if we don't think about it, then we will all be swallowed by, okay, let's just continue the conveyor belt until the body will shout in the form of a disease, in the form of a cancer or a tumor or a hypertension or a diabetes or whatever.
That's a difficult question.
Yeah.
Because when you're in that situation, it's like you cannot see yourself. You have to like distance yourself and see what's happening.
Right.
When you're right there, it's like, oh,
Mhm.
it's difficult. Yes,
Yeah.
of course, I'm willing, and I have to change some of my habits.
Yeah. That's why one of the programs of the Health Wealth University is the Free Up Your Life program. Freeing up your life can reinvent your life, can help you reinvent your life so that you rethink that maybe there's another way, not just allowing yourself to be in that conveyor belt for the rest of your life. And I believe that the Health Wealth University is the platform that can inspire people, not just to learn new tools, but actually inspire people to transform. Because nowadays there is so much information, but this is what I notice. Information do not lead to transformation. Information alone do not exactly necessarily lead to transformation. What I realize is information coupled with inspiration can lead to transformation. Information coupled with inspiration can lead to transformation. So, going back to you, do you feel that we doctors, very busy with our lives, very busy with our work, do you think that it is worth thinking or trying or envisioning that there must be another way, a more holistic way, that we can go beyond that conveyor belt of the healthcare system?
I cannot speak for all the doctors
Yes.
because
At least for yourself.
Yeah, at least for myself. Yes, I think there's a way, and we should start, and we should do it. We should be committed to it,
So,
or else we cannot serve. We cannot serve our patients.
yeah, yeah, because yeah, even as doctors, we can also get sick. It doesn't mean that doctors do not get sick. Yeah, we also get sick. But in my case, if I get sick, I like to listen to my body. I like to listen to the wisdom of my body and not just resort to what I was trained to do, take a pill and then that's it. No. And a lot of times, it's a message to slow down, a message to pause, and a message to rethink and reevaluate how we are doing things. Yeah, so maybe any
That's it.
parting words that you want to impart on our followers and audience?
So to our followers and audience, come and join us I think you will get a lot of information, be inspired. So come and join us.
So yeah. So once again, this is thank you so much, Dr. Milagros Paredes, my lovely wife, and my ex-girlfriend. And this is Dr. Romy Paredes, the co-founder of Health Wealth University, empowering you to take charge of your health and of your life. Thank you, and God bless you.